So what about an alternate approach? Well, the final approach I want to deal with is something that's also used by athletes. And you see athletes using this in competition, but also using this post-exercise, and this is the idea of limb compression garments. And they're often used to aid recovery, particularly after very strenuous exercise. And the actual rationale for this comes from clinical settings. Why? Because limb compression is used to treat inflammatory conditions, including things like lymphedema, deep vein thrombosis, and even chronic venous insufficiency. So it's, there's a real medical benefit for using limb compression garments. The notion is that compression actually can positively affect hemodynamics, attenuate swelling. Why? Because it facilitates the notion of lymphatic drainage, which we'll get to in a moment. It reduces the increase in osmotic pressure, and it's experienced as a result of tissue damage. So a little bit like we saw with the cold water immersion, where we were saying actually the cold water immersion seems to promote a restoration of tissue damage and a repair in terms of tissue damage, and it was achieving that by using a hemodynamic pressure. This is using a limb compression to actually reduce the osmotic pressure that we get when we get the tissue damage. So what do we know about this in clinical settings? Well, compression garments have been shown really to compress the dilated veins. It reduces venous reflux and therefore enhances venous return. And that's the really important part, because what you have to remember is, some people say, well, surely they reduce blood flow. No, because the key thing is, to reduce blood flow, you've got to have a really high pressure. Because remember, the arteries are under a much higher pressure than the veins. But what these are proposed to do is actually help with venous return by increasing the pressure, particularly on the venous side, and helping with this notion of what we call the muscle pump, accelerating the venous return and therefore helping in the removal of things like waste products. So if we can, as we saw with both cryotherapy, as we saw with cold water exposure, if we can actually manage the edema, it's going to reduce delayed onset muscle soreness and increase mobility. So there's a real benefit from this. And again, these are all benefits that have been seen under clinical conditions. So when we get tissue damage and we get the inflammatory response, which is the natural response, you get fluid accumulation, that increases the osmotic pressure, and so you get what is called cell lysis. So if we then apply our compression garments, they should speed up that recovery process by reducing the edema, by increasing the venous return. So what we have evidence for, again from a clinical environment, is if you get reductions in the circulating levels of creatine kinase. Remember, creatine kinase is the enzyme and therefore our proxy indicator of the phosphocreatine reaction, but also anaerobic metabolism. Well, they've been frequently reported when compression garments are worn, particularly following exercise. So there seems to be a hemodynamic effect, and the hemodynamic effect, that is that kind of venous return, is very much kind of the postulated effect in terms of enhancing the recovery for these athletes. So how does this work? Well, actually, the kind of the mechanisms behind this are actually fairly simple and are fairly similar in many ways to what you were seeing with the cold water immersion. Remember that we said with the cold water immersion, you get a hydrostatic pressure, which is acting on both the intracellular and interstitial spaces and promoting that kind of positive osmotic gradient. Well, this is just a more targeted pressure-based response. Well, it augments the calf, in this case, if we're doing it in the leg, but the muscle pump. So that then increases venous return. And you see this just wearing things like, just very simple, elastic compression stockings. And it's been promoted or shown to increase the shunting, greater blood volume through the deep veins, because you've created a compression of the superficial veins, and therefore you get this increased or enhanced capillary filtration. And what we know is the shunting of blood through these kind of deep veins, it is similar to the hemodynamic effects of exercise, but compression stockings may work by increasing femoral, this is again in the leg, vein blood flow velocity. But the surface pressure gradient is not necessarily strictly graduated. In other words, the effect is absolutely about creating a positive venous return. It's about enhancing that muscle pump effect. And so compression garments have really got quite sophisticated. A kind of a rudimentary compression garment is something like just a standard compression stocking, which just applies a universal pressure across the limb. There are more sophisticated versions, very expensive versions at the moment, which create kind of a rhythmical compression across the limb. So the compression moves up the limb. So in other words, it's kind of pushing the blood away from the limb into the central circulation. So a more sophisticated approach. We also know you wear compression garments, you get an increase in skin surface temperature. And that then also suggests, well, there might be a temperature-related effect here. Because unlike the theory for cold water immersion, which is saying, well, actually we want to move the blood to the core, this is actually saying, look, you put the compression garment onto the limb. If you put the compression garments on, you're not raising the temperature enormously, but you raise the temperature enough that helps increase blood velocity. Remember that fundamentally, the velocity of blood flow is a temperature-dependent process. So just marginally increasing the temperature, not enough to cause kind of a negative consequence, may be beneficial in terms of, again, accelerating venous return. So how does it work? Well, it's interesting. I mean, it's a fairly new concept, so actually finding material on this is slightly difficult. I mean, this is a reasonably old paper, but it goes back to perhaps more the medical grounds. So here's the external compression, and you can see it's a really low compression. It's equivalent, actually, what we use in blood flow restriction studies of what we call a sham compression. So the theory is that this shouldn't do much, but the argument in this kind of community is it does have an effect, because they're saying it increases tissue pressure, they're saying it decreases transmural vascular pressure, you get a myogenic response, so that is kind of within the muscle itself, which leads to vessel relaxation, you increase venous outflow and arterial inflow, which increases tissue oxygenation and muscle function, but they've put a question mark here. Does that lead to improved performance? Does it lead to improved physical work? The evidence from the medical community is that it's beneficial medically, right? It's particularly in inactive patient groups. Does it benefit us in terms of recovery? Well, again, not an awful lot of data on this, but this is a fairly recent paper that was published. I'm just looking for the date here myself in 2017. And what they've got is they've got a pre to post effect here, which is the change in the maximum voluntary contraction from training. And then they've got three conditions. So they've got a low pressure condition, a high pressure condition, and a sham condition, where in essence there was no real pressure being applied. And what they're showing is the effect at 24, 48, and 72 hours post compression garment being worn. And what you can see is, if you look at the sham condition, yeah, there's a recovery, because one would expect there to be a general recovery. But actually what we see is that the higher pressure group, which is not substantially higher, but it's a higher pressure group, was more beneficial than both the other groups in terms of restoration. In fact, they're back to the 100% of the MVC, 72 hours. Whereas the low pressure group and the sham group actually didn't get any higher than 90%. So there's still 10% kind of lagging here, 90% restoration. 72 hours post intervention. And if we go a little bit further into the data set here, so what you've got here is we've got some specific markers. We've got our creatine kinase, we've got myoglobin, and we've got C-reactive protein. So this is kind of an index of tissue damage. So again, creatine kinase, pre to post, you can see what you'd expect to see. So creatine kinase levels, you get kind of an increase. Now let's see what happens with the sham condition. So the sham condition, there's no real effect. Look at the high condition though. You can see in the high condition that you start to get 24 hours, you start to have a significant reduction, but we really haven't had a significant change overall in terms of creatine kinase. If you then look at myoglobin, same thing one would expect to see, myoglobin pre to post exercise, you take the sham condition here, but no significant change. But the overall thing is there is no change in any of these parameters at all. So this is really important. You can see the same in the C-reactive oxygen species as well. None of these parameters are actually showing positive effects of compression garments. So although we can see the benefits in clinical population groups, the reported evidence so far seems to be limited in terms of athletic populations. And so if we go to a meta-analysis, and again, meta-analysis is slightly limited because, again, it's a fairly developing area. But what you've got here, and what we've got is we've got in all time points. So this is kind of all time points, and then we've got kind of at a fixed time point. So we've got for non-running endurance in B, and then we've got just for kind of all endurance in A, and it's across all time points. It's everyone's irrespective of what they've done. So we have to take this slightly with a degree of caution because they've kind of amalgamated everything. But what you can see here is there is only one study here which favours the control. All the others are actually favouring the compression garment. But the overall effect across these mixed studies is only small. But actually you can see that 24 hours in this study post-exercise, so 24 hours post, they found there was a large effect in terms of the recovery. We've got this one here, which is a medium effect. So the results are quite varied. And if we look in this data set down here, the same kind of responses that we saw within this data set here. So very, very similar in terms of the overall effects. So we're not seeing any kind of positive effects in terms of perhaps metabolite restoration. Again, maybe limited by the studies, but we are certainly seeing some potential evidence here in terms of overall recovery in terms of performance. But again, limited in the overall effect.